Hi, everyone. Welcome to this session on depression and anxiety during difficult times. For those of you who don't know me, I'm Dr. Wendy Romig. I'm a doctor of clinical nutrition, and I have a clinic in Mount Airy in Philadelphia called Sage Integrative Health Center. I see people here for a wide range of health issues. Usually they have some chronic illness or a gut issue, maybe a women's health issue, but oftentimes there might be a layer of depression or anxiety that's in the mix. So as a result, I see a lot of depression and anxiety cases here at my clinic as well. So today I wanted to talk a little bit about depression and anxiety, especially in light of everything that's going on in the world right now. It's a time when people are feeling different things. They're feeling more anxious. They're feeling maybe a little bit low. They're in the house more often. They're detached from friends and family. So during this time, depression and anxiety might creep in even more. And if you're someone that has already a predisposition to depression and anxiety, then you're someone that might be feeling the impact of this even more deeply. So I wanted to start off by discussing depression and anxiety, but separately. Although they sometimes are married together, you might see someone that has depression and anxiety at the same time. They have separate they are manifested separately in people a lot of times, and they might come from different underlying imbalances in the body. So I want to talk a little bit about depression. So depression is feeling that heaviness. We're having a hard time getting out of bed. Energy is low, mood is low, just not feeling motivated. This is the common symptoms of depression, maybe sleeping more. These are things that can happen. And sometimes the depression is situational. Right now, there's a lot going on and keeping us indoors, keeping us away from loved ones that might cause us to feel more depressed. However, there are potentially some underlying health issues as well that might be contributing factors. So I did want to discuss that today, help you understand some of the things that might be going on in the body biochemically that could be contributing to depression and anxiety. One of the first things that I often will bring out in a discussion with a client or in classes is the fact that the gut is deeply connected to depression. How our gut behaves, how our gut is functioning, very much can dictate how other aspects of our health are feeling. When we have imbalances in our gut, for example, if our microbiome is out of balance, and this is a really common one, there's been a lot of studies showing the link between our microbiome in our large intestines and depression and anxiety. So what happens when we have maybe too much bad bacteria and not enough good bacteria? Maybe we have some malabsorption happening in the small intestines, meaning our nutrients are not getting into the body as easily. These are all things that can impact how our brain is functioning. If your brain's not getting the right nutrients in order to create neurotransmitters, in order to have blood sugar be utilized properly in the brain, these are all things that are going to affect our emotional health as well. So our gut is a very critical component, and things that can happen in the gut. For example, someone might experience constipation. Constipation is oftentimes the result of when more toxins are coming into the body. Constipation can be as a result of low serotonin, and we know serotonin is also a neurotransmitter hormone that's related to our mental health as well. So serotonin is actually very plentiful in the gut because it's the hormone that's required to help with peristalsis, help moving the food through the bowel and to excretion. So we know serotonin and mental health are very, very deeply linked, and it's also part of our gut function. So I often see a correlation. People that have constipation may also have some symptoms of depression. So which one came first? Was it the depression causing the constipation? Was it the constipation causing the depression? Sometimes it's not easy to tease that out. Sometimes it's situational or something further in the gut that is causing the constipation to occur, and then all of these things kind of have a cascading effect on the body. But depression is very much linked to how well our gut is functioning because of those factors. So some other things that we can look at in terms of depression is our hormonal balance. In women, we have estrogen and progesterone. When our hormones are low. So for women going through menopause, those hormones are lower. Estrogen is the happy hormone. It's the hormone that helps mitigate a lot of different biochemical processes in the body, not just fertility, but it's an uplifting hormone. When estrogen goes down, and this is something we can see in women in menopause that might have very low estrogen, that they might start feeling depression. And the same thing can happen with men too, it's andropause. It's when the androgen levels go down. And then similarly, testosterone and androgens, when they go down, these are also things that can lead to depression, or they've heard the grumpy old man syndrome, okay? So these are things that connect to our mental health. So those two things, the hormonal levels and our gut, are directly linked to our brain health and how well we're processing the world around us. Another huge component is stress. Cortisol is a major factor in all of these things. So cortisol is the stress hormone, epinephrine, norepinephrine. These are all things that can push us into that fight or flight syndrome. But what cortisol can also do is it elevates our blood sugar. And when we're under a lot of stress, we might get into this cycle of wanting to eat a lot of carbs and a lot of sugar, because it helps keep our blood sugar up, okay? So one of the things that can happen is our blood sugars can then dip. And when the blood sugar levels dip, then our mood comes down. It goes up and it comes down. And we can get into this vicious cycle of wanting to have more sugar, and more carbs. It goes up for a bit and then comes down, up for a bit and then comes down. And so stress can be a factor in this, that when someone is under a lot of stress, that their cortisol levels are getting thrown out of whack, putting too much sugar into the body, also suppressing different functions in the body, like our immune health, suppressing hormone function. When we're under a lot of stress, our hormone levels go down. And that also means that less estrogen, less testosterone, all those things that give us energy and upliftment. So you can kind of see how this cycle is unfolding. So these are some biological processes that can affect our mood. But let's talk a little bit about nutrition as well. Nutrition is a huge component for mood. And some of the things that I mentioned before with sugar and simple carbs can lead us into this vicious cycle of this up and down curve, feeling energy, then down, energy, and then down. So I want to be really careful about the foods that we're eating. Having good, healthy fats in the diet, avocados, coconut oil, nuts and seeds. These are all really great things that will help support healthy brain function. And having too much sugar can cause long-term damage in the brain. If our blood sugar levels are consistently too high, which can happen in diabetes, you might run the risk of also having damage to certain neurons in the brain. So we want to be really careful about that as well. With too much sugar in the body to elevate blood sugar levels too much, it definitely affects our brain health. So nutrition, getting those dark leafy greens, lots of fruits and vegetables into the diet, these are things that are going to be really, really critical for good brain health. Another thing that's outside of nutrition, but might be more external factors, the seasons. Changing of seasons is a big component for people. Some people get seasonal affective disorder, which is really when there's not enough sunlight, vitamin D levels are going down, we are inside more, it's dark. This is where the mood can slip. And we want to be aware of that. The more we're aware of that, there's different therapies, light therapies, for example, that can help improve the mood. And exercise, taking vitamin D supplement. These are all things that can help boost the mood during the seasonal lows. Lastly, with depression, sometimes we're just feeling sad because of a loss. And it's important to acknowledge that that sadness is due to something situational that's happened in your life. And maybe you just need more time to process it. Maybe it's time for some journaling, meditation, prayer, seeking out some psychotherapy to help you work through those emotions and that loss. These are all important things to consider. The problem is that for some people, they might have a period of loss or trauma that brings them to a place of depression, but then they get stuck. They have a hard time moving out of this. And this is where it can be very difficult. And this is where diet, exercise, some counseling, meditation, prayer can all be very beneficial to help move one away from feeling stuck in a space that of an event that may have happened years ago. And so I really encourage taking a look at some of these things in your own life. Now, some other things that can impact depression and mood are alcohol. Alcohol is a depressant, and it's unfortunately a common thing to go to because it can numb the emotions if it is a trauma or a loss-related event that is causing the depression. So alcohol can help blunt those feelings, but it also brings the mood down because of the nature. Alcohol is, as I said, it's a depressant. So we want to be really careful about putting alcohol and even caffeine. Caffeine gets us on that roller coaster again, up and then down. So being really, really mindful of how these things are coming into our lives. So depression, we're looking at top to bottom. We've got looking at our gut. How healthy is our gut? Are we having problems with constipation or slow digestion? Are we having gas and bloating symptoms that might indicate poor gut health? Looking at our hormonal balance. If you're a woman and you're experiencing a lot of hot flashes, night sweats, mood changes, it could be because your estrogen levels are too low. And as I mentioned with the adrenal glands, when we're under a lot of stress, the adrenal glands suppress estrogen. And post-menopause, the adrenal glands produce estrogen. So if our adrenal glands are taxed, the estrogen levels will go down if the adrenals aren't able to produce adequate estrogen to make up for the loss after menopause. And then looking at also just the stress levels in general and how those affect all aspects of our body. Looking at our diet, making sure we're having a good, healthy, nourishing, plant-based diet in the mix. So these are some really good components for depression. Let's take a quick glance at some supplements and some herbs for depression. I mentioned a couple. Vitamin D is a supplement that can be very useful for depression. Vitamin D has been shown to increase our mood. There's another supplement that I have used successfully on occasion. I don't like to rely too heavily on supplements. I really like to look at the other factors like nutrition and lifestyle, but this is one that can help is SAMe, S-A-M-E-E. SAMe is one that can help elevate the mood. So SAMe, I have been able to work with some of my patients to help elevate their mood, using it as a bridge. Okay, we want to just use it as a bridge to get us over the hump so we maybe have enough energy, our mood's elevated just enough that we can make those lifestyle changes. Sometimes it's hard to even make changes when we're so stuck. Some herbs that we can consider are hawthorn. Hawthorn is a great herb. I do all of the herbs I recommend. I usually recommend them in tincture form. And one thing to remember about herbal medicine is a potent form of healing, and it can interact with other medications. So before you start putting a whole bunch of herbs into your pharmacopoeia, double check with someone to make sure it's not going to interact with something that you're on already. Case in point, St. John's wort. St. John's wort is famous for interacting with all kinds of meds, so I really try to keep away from St. John's wort for a lot of people, especially if they're on a lot of pharmaceuticals when they come in. St. John's wort, interestingly enough, even though it's used now for depression, a lot of studies have been done on St. John's wort for depression, it actually was used traditionally as an herb for nerve damage and nerve pain. So even though it has that traditional use, the depression side is what's really gotten the most recognition. Other things are rose petal. You can consider holy basil, evening primrose. These are gotu kola is really good for mood and cognitive function. These are things that can uplift, and you might even want to look at an essential oil diffuser for your house. Essential oil diffusers are great, getting uplifting scents like orange and lemon, peppermint, rosemary, bergamot. These are all very uplifting scents that you can have going in a diffuser throughout your house and just really help provide that uplifting atmosphere. Because it's more than just, it's not a one-dimensional situation we're looking at. It's the whole picture. How is your home? Is your home conducive to keeping your mood elevated? Is your food conducive to keeping your mood elevated? Is your lifestyle, your exercise, your connection with other people, even if we're in a shutdown right now, that you are making phone calls, talking to people on Skype or Zoom, making sure that your lifestyle is conducive to having an elevated mood. So I hope that helps a little bit give an understanding of depression. I'm going to move on to anxiety. Because although depression and anxiety can coexist in the same person. They are different animals to some degree. And with anxiety, I see a lot of times, like I see people with anxiety that might have elevated thyroid function. And I didn't mention it for depression, but depression could also be low thyroid. So we want to check that thyroid too, make sure that there's not a hypothyroid condition with depression. With anxiety, we want to do the opposite. We want to check to make sure it's not hyperthyroid. So the thyroid definitely can have an impact on mood. With anxiety as well, we want to make sure that the person's getting enough sleep. Sleep is very much can contribute to anxiety, and anxiety contribute to poor sleep patterns. So making sure that there is not a sleep issue happening there that might be kind of creating this vicious cycle around anxiety. Other things that we want to look at is stress. So I mentioned stress in terms of depression, and the same thing happens in terms of anxiety. Epinephrine and norepinephrine are excitatory hormones. That means that when we're in a stressful state, just in that buzzing, right? And when people have anxiety, they get in these loops, right? Their brain is very active, it's very restless. They get hyper-focused in a loop, and oftentimes have a hard time letting go of it. And anxiety often comes as a result of not knowing, uncertainty, what's going to happen, and then trying to relive that situation in many different scenarios. And that actually can put a lot of stress on the body. Every time we are creating a scenario in our head, our stress levels are going up, and the body's feeling the stress almost as if we're living that situation. So we want to be really careful about our thoughts and making sure that our thoughts are not generating this vicious cycle of stress, so that we're having the stress response in our body actually heightened. And unfortunately, when the stress response is turned on, there are certain things that get turned off. That means digestion, because I've mentioned this in many of my classes. When we're in fight or flight mode, who cares if we've digested our food? It doesn't matter. It's not important, because hopefully the situation is a short-term thing that the body will return to normal function and digestion will return. But for a lot of people that are in chronic stress and chronic anxiety, they're feeling that all the time. Digestion is blunted. It's turned down, which means that the nutrient absorption is going to go down. Digestion slows down. I see constipation frequently in people with anxiety because they don't have enough digestive power to digest the proteins that are going into their body. And it can also create a lot of electrolyte imbalances in the body because our adrenals are getting taxed. And there are certain hormones in our adrenal glands that help balance salt and water. When those hormones are not produced as well, we get this salt-water imbalance, and we might even crave salt. So these are things that can have very deep impact on the body. Other things that can happen with anxiety, physiologically speaking, is that it can cause palpitations. So we might think that we have a cardiovascular issue, a heart issue, and when in fact it is just anxiety. Of course, it's always good to go to get that checked out by your primary care physician if you are experiencing heart issues. Oftentimes they might say it's anxiety, especially if you're someone that has that propensity. So these are some of the symptoms that can come along with anxiety. However, there are things to do. And anxiety is a tough one because it's the brain wants to just go, 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 think, work through the solution, try and predict the future so that you have a way to prepare for what might come. There's no unknowns, right? So that you don't feel surprised, caught off guard. And this is what can happen with anxiety, is what's going to happen. And that's unfortunately just very counterproductive for our health. But in terms of looking at anxiety from a nutritional standpoint, we want to think about things that are grounding, but not too heavy on the digestive tract, because anxiety turns digestion off. We don't want to be loading it down with all these heavy meats and cheeses and heavy fried foods and things like that when our stomach just isn't going to be able to do much with it. So we want to be very careful. Anxiety requires a little bit lighter food, at least initially, but the nutrients need to be very, dense and high antioxidant in order to counteract the amount of stress and energy. Anxiety requires a lot of energy, which means that it produces a lot of oxidative stress. When the body's producing energy, it has exhaust. The exhaust fumes are those reactive oxygen species that you may have heard of. And those reactive oxygen species have they can be damaging to the cells of the body. So we need to increase the antioxidant intake in our foods, maybe through a supplement like vitamin C. Something simple like that can be really beneficial. Making sure you're getting those healthy fats, healthy proteins, as I mentioned, for depression as well. Nut butters, avocados, things like that. So again, with supplements, you can think about B-complex. B-complex is really good for stress response, and it helps with energy production in the body. It helps with blood sugar regulation and the glucose pathways in the body. So making sure that you're getting your B vitamins in. A B-complex is a good way to get it in initially, but getting your B vitamins also through those grains, nuts and seeds, beans, things like that. Making sure you're getting the omega-3 fatty acids in. Also for depression, I have used those with some of the clients coming in to see me in a supplement form, though I haven't seen enough benefit with omega-3s with depression and anxiety to rely on it as a supplement of choice. I really tend to go to the herbal medicine side of things, and so we'll get into some herbs that can be really beneficial for anxiety. Things with herbal medicine for anxiety are things like lemon balm. And it's a very calming, soothing herb. Our farm here at Weaver's Way often grows lemon balm in their garden that you can pick and have it fresh. It's really lovely as a tea. Hawthorn is another one that can be used. I like to use ashwagandha. Ashwagandha is a traditional Ayurvedic herb, and it has anti-anxiety capabilities in it. So but if you're on any kind of thyroid medication, you want to avoid ashwagandha. Same with lemon balm, it doesn't go well with thyroid issues either. So just be aware of those. Linden flower is another herb that's very calming and soothing. Also chamomile. Chamomile is just one of those very gentle herbs. You can be sipping chamomile tea throughout the day. It has a bit of an aromatherapy value when you're sipping it, with maybe a little bit of lavender in there that can be very calming and soothing to the nerves. Oats is another one. So even just having oatmeal, but there's oats in the tincture form that is a little bit sedating, but it's also calming. For people that have acute panic attacks, that have severe anxiety, I actually like to use valerian root in the tincture form. So this is, if you have panic attacks, you just find yourself in a situation just all of a sudden feeling very anxious, something that you feel afraid, things are out of your control, you might want to keep a little bottle of valerian root with you, and just do maybe 6 to 10 drops under the tongue as needed, and it will help. It's sedating, so just be careful. You don't have to drive or don't take too much. But valerian root can be very beneficial for acute anxiety and panic. So that might be something, if you're that type of person, you might want to look into that. Other things are kava. Kava can be really good for someone that has gut issues. They might have slow digestion, they might have constipation, poor production of hydrochloric acid and enzymes because they're in a state of anxiety and stress all the time. Taking kava between meals is a good way to calm the body so that the body can get into that rest and digest mode. Because when we're in a state of anxiety and we're eating, the body is not in a state of digestion. It is in a state of alert, and things are going to just sit there. So we heard this term, rest and digest, rest and digest. And this is kava and maybe a little bit of oats, maybe a couple drops of valerian. These are all things that can help soothe the nervous system, calm the body enough so that the body can start digesting food more effectively. Passion flower is another really great herb, and people that have anxiety often have difficulty sleeping. The two tend to go hand in hand. So finding some good techniques before bed, maybe just reading some very leisurely book, staying off of screens, staying off of the phone, things that are going to wake your brain up even more, doing some deep breathing exercises and meditation before bed, maybe some gentle yoga. These are all things that might be worth looking into. As far as exercise goes for people with anxiety, I recommend yoga. Yoga and going for walks, not a lot of high intensity activity. Body's already in a high intensity space all day by being in a more anxious mood. So things that are going to calm the nervous system down, stretch it out, open the body up, allow space for breathing. These are the types of activities that you want to keep in for exercise. So you're not going to be maybe doing those heavy mega sets and endurance, things like that. It's still, the exercise like that can be good for someone that has anxiety, but those endorphins can really push someone over the edge too. And the level of cortisol going up and the epinephrine, norepinephrine that are all excitatory coming in all at the same time might be counterproductive, but everyone's different. So you have to see what works for you. Like I said, I recommend yoga, stretching, long walks, things like that, gentle exercise, elliptical. Those are all good things that are better paired with anxiety. With depression, someone wants to just get the heart rate going. Okay, with depression, you gotta just try and get yourself out and get yourself moving, get your blood rate up a little bit, get yourself active and your blood flow going. So these are some things that are good considerations for depression and anxiety. And lastly, I just wanted to kind of talk about the bigger picture of depression and anxiety and take a step back for a minute, because it is a difficult time. And as I mentioned in the beginning of this lecture, that it's not easy to pull ourselves out all the time. So sometimes we need to take a minute to just journal, take some deep breaths, reflect, go deep and ask ourselves, what's the root cause here? Is there anything that's underlying that might be contributing or keeping me stuck in this space? What can I do just today, even if it's just for one day, that you can do to help with your mood, to help keep you in a calmer space, or to help lift you out of a place of being stuck? These are all things that are important to consider. It takes 2 weeks to create a habit. And the new habit might be that you're journaling every day, and maybe that's going to help you. Your new habit might be that you're meditating or doing yoga every day. Maybe your new habit is doing some high energy exercise to get you unstuck from a lower place. Whatever that is, try not to take too much on all at once. It's overwhelming and your body is already not feeling at tip top because there's the stress from the anxiety or the depression. So pick one thing, just pick one thing for 2 weeks that you think you can change and do consistently every day. And if that thing is journaling, make sure you have a journal, pick your dates that you're going to journal in it, and do it every day. Even if you have nothing to write in your journal except for, I have nothing to write today, I'm not sure why I'm doing this, just go through the exercise and make a commitment that every day, and it will open up, things will flow, and see how it goes. Same thing with dietary changes. Anytime you're making changes, it's important to A, be gentle on yourself, but B, be realistic about changes that you're making and how they're going to affect your life. So it's important to not make a complete dietary overhaul or take on this crazy new workout schedule if after 2 weeks it's kind of going to burn you out and it's not something you can maintain. Because the point of is making changes. We're creating new pathways in the brain. We're creating new habits. We're creating space in different ways in our life to be able to align in our bodies better, to be able to help us stay in a more even space, not too low, not too high. And this is the change that can formulate over time. It's a gradual process. Coming out of these things it's not overnight. And so it's the one thing I like to always make sure to emphasize is to be gentle on yourself. And of course, if you ever have any questions, you're welcome to reach out. You can always go to my website, sageintegrativehealth.com. I'm Dr. Wendy Romig. Happy to answer any questions. You can always schedule a 15-minute free phone consultation with me as well. So I hope this half-hour session has been helpful for you. Look forward to hearing from all of you. I hope you have a wonderful, wonderful, and peaceful day. Take care.